Good morning, good morning, good morning. Do we have Reverend Mosley?
I'm here.
Good morning, Reverend Mosley. If you would be so kind and to open our event in prayer this morning.
Let us pray. Father, we do thank you and glorify you for this day, and we thank you for your many blessings that you have bestowed upon us. We thank you for this time and opportunity to recognize this time in history, Black Women's History Month, National Action Network, Los Angeles. We thank you for the participants and those that will be speaking and talking about health and wealth, the wellness process. We know that you have already declared, or would that you prosper and be in good health, even as your soul does prosper. So we thank you in advance for what you're going to give to us, what you're going to teach us, and what we will learn from these great women that are yielding their gifts on this day. These are all blessings we ask in Jesus' name. Amen.
Amen. Thank you, Reverend Mosley. And good morning, good morning, good morning, everyone. Welcome to the Women's Health Forum with National Action Network Los Angeles. My name is Lori Candinas. I am president of the chapter here in Los Angeles. NAN is one of the leading civil rights organizations in the nation. It was founded in 1991 by our national president, the Reverend Al Sharpton. We are on the front lines for justice, equality, justice for all, as the Pledge of Allegiance states. We're currently on the front lines fighting for voting rights. As you all know, the Republicans are trying to gut that. So we are fighting for voting rights, trying to stop voter suppression, police accountability, so our Black queens and kings stop being killed on the streets indiscriminately, and much more, much more. If you would like to help fight on the front lines with us, please join our chapter. I'm going to put the Cash App link in the chat for you. It's $25 a year to come out and help fight with us on the front lines. So if you are interested, I've just put the Cash App link in the chat, $25 a year. Please come join us. Come out and help us to gain justice and equality and fairness for all. And with that, I would like to introduce our guest speaker for today, Dr. Arleen Brown. She is a MD, PhD, and a professor of medicine in the Division of General Internal Medicine and Health Services Research at the University of California, HSR at Olive View UCLA Medical Center. Dr. Brown's research focuses on improving health outcomes, enhancing health quality, and reducing disparities for adults with chronic conditions such as diabetes, cardiovascular disease, and stroke. She has been a principal investigator on studies to improve diabetes care for older adults and minority patients, and research to understand clinical, socioeconomic, and health system influences on chronic disease management in under-resourced communities. She is currently a principal investigator on several projects, including a study to improve cardiovascular outcomes among persons with history of trauma who are living with HIV and AIDS, research to reduce disparities in blood pressure control for patients in the Los Angeles County safety net system, and studies to mitigate disparities in COVID-19. We want to welcome you, Dr. Brown, to our health forum today. And I just wanted to can you talk to us a little bit about why we still have these issues today? With all the advancements in medicine, why are we still fighting these struggles in the healthcare system?
You know, first of all, I want to thank you for inviting me to join you today. This is such an important network, and the work you're doing is vital to our community and to all communities. You ask a great question. It is so important for us to think about health and well-being, not just in terms of healthcare, but in terms of our social circumstances. So part of the reason we keep seeing disparities and inequities is because we live in an unjust and inequitable society. So it starts before we're born. It starts with, kind of the situation in the womb. So Black women who are pregnant, who face stressors, they pass that stress on to their babies. And so Black women have much higher rates of preterm birth and low birth weight. And then all across the spectrum, from birth to old age, the inequities that we face in our educational system, in our access to good quality housing, in access to good quality food, all of that has an impact on our physical and our emotional health. So we can't just say, oh, the healthcare system is the problem. It's actually a much bigger problem.
I understand. And with COVID, with the pandemic, which we know exasperated the healthcare system, can you discuss because the pandemic really put a microscope on the disparities for minorities in the healthcare system. Can you speak on that or expand on that a little bit?
Absolutely. When you think about COVID, it's really important to think about not just the virus, but the virus hit the people who were most vulnerable on many levels in terms of their the physical issues and clinical issues like diabetes, hypertension, heart disease, asthma. So people with those conditions were much more likely to get COVID and to get very sick from COVID. And then when you add to that certain situations made you more likely to be exposed and more likely to become infected. So living in multi-generational households, like many African American and Latino individuals do, where you have people who are at very high risk because of age or because of other chronic conditions, working in jobs that make you more likely to be exposed. So if you were a frontline worker, and we changed our definition of what a frontline worker was. So we used to think about nurses and doctors and techs in the health centers, but frontline workers work in grocery stores. They work in retail all across the board, in restaurants, and think about when you think about people who work in other situations like undertakers. They were at very high risk for getting COVID. So people who are engaging with other people, often in jobs that don't pay them enough to get the healthcare that they need and don't give them enough funding so that they can protect themselves, and didn't give them the resources to protect themselves. So we've got to think about this really broadly. It's not just about healthcare.
Could you, because I've always wondered, how is it that Black women seem to get the brunt of the healthcare system as it relates to childbirth, all the way to asthma, as you said. I have asthma, so I have dealt with the healthcare system my whole life on this issue. Why do you think that Black women are catching the brunt from the healthcare system?
Yeah, it's both within the healthcare system and outside of the system. So for Black women have some of the most, are in some ways some of the most vulnerable in our society. We often have the jobs that put us at highest risk for exposure. There are stressors at home, at work, and often you're the backbone of the family. So it's both the expectations are high for what your roles are, but then on top of that, you take on those expectations. We talk a lot about John Henryism in Black men in particular, but you see the same phenomenon in Black women. So you internalize those stressors, and internalizing it can have a devastating effect on your physical health and your mental health. So all of these things combined. So it's kind of it's where we live, it's the jobs we have, it's the diet we have, it's the ability to exercise in places where it's often hard to exercise. It's having jobs where you don't have the opportunities to advance. And so all of these things together put us at higher risk. Take, for example, diabetes. So, diabetes is a chronic condition that affects a lot of people across the world. Black women, however, particularly young and middle-aged Black women, have some of the highest rates of diabetes in the country. And part of the reason for that is, there may be some higher genetic risk, but the real problem is it's not biology. It's that it's diet, it's exercise, it's the ability to get access to medications. So both prevention and treatment are unavailable in a lot of cases for Black women.
I know you had some slides that you wanted to share. Are you able to do that?
Sure, I can try to share this, and let me see if it'll let me do this. Oh, it says I have no slides. Let me see my computer. Okay, I think it may let me do it in a bit. Let me see if I can pull this up. Give me just 1 minute.
We have folks like you that can help encourage and help us with our health so that we can go a little longer.
So it looks like I uploaded them, but let me see if it'll let me share them now. Oh, it's processing it. Okay.
We have had technical difficulties. I just want to apologize to everyone.
No problem.
For us to start.
I'm sorry for adding to them.
Sometimes.
Yeah, usually I can just upload them from my computer, but it looks like there's an additional step here. But I'm happy to take any questions in the meantime.
I believe so. Well, I think I have one more, if you don't mind.
Oh, can you see them now?
Oh, yes, ma'am.
Okay, great. Alrighty. So I'm just going to talk a little bit about diabetes. And as I mentioned, Black women are disproportionately affected. And we have earlier onset, we have higher rates than either Black men or white men or women, particularly in that 40 to 60 age group. And then we have higher rates of complications. So just to say what diabetes is, and I think one of the things that's really important is to understand the impact of something like diabetes in our country. So every day, every 24 hours, we have over 4,000 new cases of diabetes, 200 deaths from diabetes, 230 amputations, 120 cases of kidney failure, and 50 new cases of blindness. So it's a devastating disease. And what diabetes is, I think a lot of people don't understand, is that it's related to your body's ability to process sugar. So when you eat something that has any type of sugar in it, it sends that food gets broken down into the bloodstream. And then your pancreas makes an enzyme called insulin that helps get the sugar from the bloodstream into the cells where it's needed. And you can think about sugar as like fuel for your cells. So with diabetes, you've got too much sugar in the wrong place. It's in your bloodstream and not in the cells where it's needed. And we often think about the different types. Type 1 is where your body just stops making insulin altogether almost. Type 2, your body makes some insulin, but either you don't make enough or it's not working very well. And then a third one that we need to think about is gestational diabetes, which happens during pregnancy. Sometimes that goes away, but you have to be really careful because Black women often will get gestational diabetes and think, oh, once the baby's born, the diabetes goes away. That's not true. Often those women, and very high rates, within 3 or 4 years have full-blown diabetes. So that's where if a doctor tells you during pregnancy, oh, you have gestational diabetes, you need to be very careful about figuring out how to prevent diabetes from preventing yourself from getting type 2 diabetes. So this is just sort of a schematic that shows the glucose in your bloodstream. Those are the little blue dots, and your insulin, the yellow dots, and the insulin binds to the glucose and gets it into your cells. In the most common form of diabetes, which is related to insulin resistance, your body is making, you get the sugar in your bloodstream, your body's making insulin, but the insulin is not getting adequate amounts into your bloodstream. And so it's kind of like a lock and key, the way insulin works. So in type 1, you don't have any insulin, so you don't have the key. In type 2, you have a key, but it doesn't fit the lock. And so, but there's a way to overcome it in type 2. So there are a lot of risk factors for type 2 diabetes. They're related to weight. So being overweight or obese is associated with higher rates. Not exercising, having a sedentary lifestyle. Age is simply a risk factor. So people over 45 are more likely to have it. If you have high blood pressure, you're more likely to get it. If you have a family member, a biological relative who has any type of diabetes, you're at higher risk. And then if you have either gestational diabetes or a baby that weighed more than 9 pounds at birth, even if you yourself weren't diagnosed with gestational diabetes. And there are a lot of signs and symptoms. So people sometimes say, well, I'm urinating more, I'm really thirsty, getting up, having to get up at night and run to the bathroom, being really, really hungry all the time, weight gain, and sometimes there's weight loss because you pee out the sugar and you lose weight as a result of that. Sometimes it's fatigue, blurry vision is very common. And then there's a skin condition that sometimes people see and don't realize what it is. It's called acanthosis nigricans. So it's often dark skin around the neck or under the armpits. And these are some pictures of it because it'll look different on different skin tones. And it's something that you should be aware of with kids, because kids who they may not have full-blown diabetes, but they have high levels of blood sugars. You can see sort of this dark line along the back of the neck, and it doesn't wash off. It looks like dirt, but it doesn't wash off. So we sometimes refer to the ABCs of diabetes. You need to know how to care for it. So A1C is your average blood sugar over the past 3 months or so. It should be less than 7. B is blood pressure, and C is cholesterol. So the reason for that is that blood pressure, you want your blood pressure below 130/80. You want your cholesterol in good range. People with diabetes usually don't die of the diabetes. They die of heart disease. And the risk of heart disease is compounded when your blood pressure is high, when your cholesterol is high. So we kind of take them as a group. And if you have diabetes, we treat you almost as if you have the same risk of a heart attack as someone who's already had a heart attack. Now, the other thing is, we often focus on the medical parts of managing your diabetes. So thinking about taking medications, insulin or pills, but a lot can be done before you start taking medications. And you really want to make sure increasing physical activity, losing weight, they should be part of the regimen. And I usually say you try to do them all at the same time. And if with physical activity and weight loss, the blood pressure, the blood sugar control gets better, you often can peel back some of the medications. But I often start all these things at the same time. The other thing that we don't think about a lot, and it relates to that John Henryism that I was talking about earlier, is managing stress. So Black women take that stress on, you take on everybody else's stress. And if we can manage our stress better, and get others to help you manage that stress, that's really critical. It's really important not to quote unquote blame the victim. It's going to be on you to manage all the stress that's coming at you. We think of our families are really important, and we need to bring our families to the table to help us with this for a few reasons. One is sometimes they're the source of the stress, so you got to bring them in and let them know what's happening to you. Number two is sometimes they're at high risk or even higher risk of diabetes and hypertension and all these other conditions. So if you can work as a team, you can make a real difference. So we need to bring our families and our communities to the table. And so the things, as I mentioned before, is physical activity, meal planning, be mindful of what you eat and how you eat, notice what you eat, take the medications that are prescribed. And if the meds aren't working, you need to talk to your doctor. And I want to talk a little bit more about that in a minute. Making sure you're checking your blood sugar and visiting that doctor. The other things that I want to highlight a couple things. That diabetes is a chronic disease. It affects the way your body uses food for energy. And I really want to highlight the last two lines here. Type 2 diabetes can be managed and it can be prevented. So if you're at pre-diabetes or high risk for diabetes, it can definitely be prevented. The American Diabetes Association is a great resource for a lot of information, and I put some information here, but you can just go to www.diabetes.org. The other thing I want to highlight is working with your doctor, nurse, or other healthcare providers. And I highlight this picture because it shows a woman who is engaging with her doctor. And it's not just talking to them, but it's actually looking at your chart, looking at your records, looking at your numbers and understanding what they mean. That's really critical. And so we actually have some recommendations for really working with your providers, really preparing. Keep track of what your numbers are. Get copies of those reports and bring them to the next visit. List the symptoms that you're having. And if you have started a medication and it doesn't seem to be sitting well with you, you need to let your provider know that. There are a lot of new medications out there for diabetes, pill form, injection form, as well as insulin. And so you don't have to stick to any one if it's not working for you. And so the first thing is prepare. The second thing is ask questions. If you don't understand something that was told to you, make sure you ask about it. Ask them to repeat it. And so sometimes what I'll ask my patients to do is tell me what I just told them, and not in a condescending way. I just want to know what they heard me say, because sometimes I think I'm saying something, but that's not what they're hearing. And then the last is taking action. And sometimes that taking action is bringing a friend or a family member to a visit, having someone else listen in and make sure that you're both hearing the same thing. And it helps your family to understand what this disease is and what you're going through. And now I've talked to you here about diabetes, but I want you to recognize that a lot of the same things could be said about hypertension, about asthma, about high cholesterol. And so it's kind of the approach to really working with the medical community, but then also thinking about our larger community. So I'm going to end there, and happy to take questions, both from our host or from the audience.
Thank you. That was so informative and very good information. I hope folks took some notes and can pass that to their family. I believe we do have some questions. So we are going to bring in our very own policy director, Rashida Kilpatrick, who has some questions from the audience. Rashida?
Uh-oh, I was muted. Can you hear me?
We can hear you.
Hello. First of all, doctor, thank you so much for being here. I was definitely one of the people taking notes because I don't have diabetes right now, thank God, but I definitely have a couple people that have told me they're pre-diabetic. And I was actually pretty shocked about how, I think when I was younger, we talked about diabetes and it was generally older people, right? It was people that have been living for a while. But now I feel like, and maybe this is just a part of me getting older and older, but I feel like I hear about it more and more in younger people. Are you finding that in your research, or is that just me getting old?
Well, that's a great question. And I must say that you being old doesn't I think when you say older, it means something totally different than when I say it. But I will say you hit a really, really important point. They did a big study called Search for Diabetes in Youth. And what they did is they looked across like 5 or 6 racial ethnic groups to try to understand. We were seeing higher numbers of diabetes in kids, to understand who gets diabetes. And what they found is, particularly after about the age of 10, you start to see an upsurge in diabetes and pre-diabetes in kids. So, and it disproportionately affects Black, Latino, and some Asian children, and American Indian, Alaska Native kids. So these kids are at much higher risk. And the problem with diabetes is the earlier you get it, the worse the complications are. So we try to keep, that's why we would say, if you're in that pre-diabetes range, let's do everything we can to prevent you from tipping over to diabetes, because having diabetes puts you at much, much higher risk of all those other consequences. Diabetes affects every single organ system, starting from the head to the toe. It affects the brain. You can get stroke. It affects your eye. It affects your teeth, the heart, the kidneys, your sexual functioning, and amputations, your feet, your sensation. You get numbness and tingling in the hands and feet when you have poor control of your diabetes. So it's recognizing that, our youth are where we need to start. Try to prevent them from getting diabetes. But people in your age group, every decade that you can prevent someone from getting diabetes, you increase their longevity and you increase their long-term functioning. They have healthier older ages, and they'll live to those older ages if you can prevent them from getting diabetes.
Oh, that's a good point. Wow, studying diabetes in the youth, that is crazy to me. That's good to know, though. It's good to know.
And they're following these kids for years now.
Yeah, wow. I actually would love to know more about that study. Maybe we can get something and put it up on our website. For sure, because we know for having the bad sugars in our communities.
Exactly.
So we have to make sure. Let's see. Okay, so I am also taking questions, and just so everyone remembers that you can put your questions in the chat on Facebook. I have my Facebook page up, and on our website as well. So one of the questions from Rosetta in Maryland says, I was shocked to hear about the high amounts of deaths at birth for Black mothers and newborns. Does this have anything to do with the disparity surrounding diabetes or other health issues that you mentioned earlier?
That is a great question. We still don't have a good answer. We're trying to figure this out. It probably is related to stress. And when I say stress, it's sort of stress on the body and on the cells. And some of that is from high blood sugars. Some of that is from just a range of other factors. It's the emotional well-being of mothers and babies that can take a toll if you're in a situation that's highly stressful. But it's also the physical stressors that families face. So I think it's really hard to sort out. There's a lot of work being done to try to understand that right now.
Yeah. I was actually encouraged by at least knowing that there's more research going on about it. I mean, when Serena could almost die from it on many levels, right? Not just because she's a multimillionaire, but also because she seems to be pretty healthy, right? So when something like that can go wrong with her, everyone's like, ooh.
Yeah. And you're absolutely right. So wealth doesn't look like it protects you that much in this case, and social status doesn't protect you. But I think it's a combination of things that goes from the biology, understanding like what's happening in the body and what's putting Black women at risk. But it's also the clinical care that you get. Sometimes people are more dismissive and they overlook things in women who are at high risk that they shouldn't be overlooking.
Yes, actually, we have a question about that. Okay, Roger from Florida. You talked about working with the medical community. Is it true that doctors are less likely to diagnose diabetes in Black people because our pre-diabetes symptoms can be different from other races?
That's a really great question. And there's a lot of work that's been done to try to understand when there's kind of bias in the medical encounter. And it's kind of interesting because for certain conditions like hypertension and diabetes, actually, they're more likely to diagnose Black people, in part because there's sort of this heightened awareness now that women. So we were seeing that Black people were more likely to be aware that they had hypertension, to be aware that they have diabetes, and certain other groups, including Latinos, were less likely to be aware. But that's changing now.
Oh, good. And did you find that in your particular research? Like, do you research? I know you actually research actual medical stuff, but do you also research relationships or how doctors react to their patients and whatnot? And did you find anything interesting in that part of your research?
I think one of the things that we've learned from a lot of women, particularly Black women in the research that we've done, is there's a stigma to talking about this publicly. So, we had Black women who said their family members didn't know they had diabetes. So there's two levels. There's a level at which, the patient, him or herself, the individual may not know they have diabetes. And we need to make sure that's why we're much more aggressive about checking and screening. But sometimes when an individual finds out, they feel shamed because, it's because I'm overweight, or it's because I don't have, or, I didn't do something right. And we want to take that stigma away. And that's why I think it's so important to have family members understand that, it's not a blame game. Diabetes is a chronic condition that's treatable. And if you can help one person in your family who has diabetes, you may help other people in your family prevent them from getting diabetes. Because if the whole family adopts the healthy behaviors, that decreases the chance that other people in the family will get the disease.
Got you. And let's see here. Oh, okay. This is Joan. Joan didn't tell us where she's from, but it did say, it has been said the best way to combat violence is with a job. Can you say a great way to fight healthcare issues? Because you point out the connection between health and stress is also to fight healthcare is a job as well. Yeah. So fighting healthcare with a job, I think is.
Yeah, so fighting disease is, we talk about, the great new discoveries, a new pill, a new medication, a new therapy or procedure. And what we're learning is that we can prevent a lot of disease by simply giving people, there's a lot of feedback.
Sorry about that. I'm trying to deal with the Facebook. Okay, go ahead.
So we can prevent a lot of diseases like diabetes by giving people the resources that they need. Food insecurity is actually one of those examples. So people who are more food insecure often eat more because they're eating more unhealthy food because you don't know when you're going to get your next meal. So you'll eat lower cost food that's more unhealthy for you. So it's really important to think about all of the ways that, having a certain level of security can help you help prevent these chronic conditions that seem so insurmountable and that disproportionately affect the African-American community.
Right. No, I agree. So we have Tia Delaney, who is one of our healthcare specialists here at NANLA. Hey, Tia, thanks for watching, girl. She has a question. What are some preventative measures women can take to improve their overall healthcare? Oh, that came from her sister, Taliba, actually. Hey, Taliba.
So these are great questions. So one thing, as we talked about before, I think a healthy diet and regular exercise. And when we say regular exercise, it's not like running out and doing a marathon or playing like Serena. It's instead really like 15 to 20 minutes a day walking. and doing that at least 5 days a week. So if you can do like 150 minutes a week of walking, and walking so you perspire, that can make a huge difference in your overall health and fitness. Really thinking about what we put into our bodies. Not just, a lot of people have a lot of issues with medications. We've seen a lot of issues around vaccines recently, but it's really, what we eat every day that has a much bigger impact. The other thing is there are a lot of recommended preventive measures in addition to diet and exercise. So for women, over the age of 40, getting a mammogram, for women, getting a pap smear. I've seen too many Black and Latino women die from uterine cancer that was entirely preventable. So, we have a lot of preventive measures, and some of that involves going to the doctor. Some of it starts at home. But there are a lot of things that we can do to give ourselves the best chance of living to see our children and grandchildren thrive.
We have a couple more questions. Tia actually asked more questions about Black women not being heard by their clinicians. Is there a certain steps you can do to make sure you're being heard by your clinicians?
Yeah, I think that the first step is making sure they're sitting and talking to you. And, recently with the pandemic, the way we engage with clinicians has changed dramatically, more virtual visits, more phone visits. And you can harness those things. I think the first thing is to sit down and really have a conversation with the physician about who you are and what your goals are. But also listening to him or her about what their goals are for you, because too often we aren't talking to each other. We're just saying, oh, you need to do this, and here are some labs that you need to go get. Right. And the patient is like, wait, but I need to talk to you about what's happening in my life. And so the second thing is, if you have a physician or other provider who's not talking to you about what's happening in your life, you need to find a different doctor or a nurse or a physician. Right. So find somebody else. The other thing I would say is, I talked about bringing someone to the visit. They don't have to be there for the whole visit, but it's someone who can look at the interaction, and I'm fine with people coming in as long as there aren't 10 people in the room. But, you have a second person who's there to help you process what you're hearing. That can make a huge difference as well.
Okay. No, I like that. I actually have become the note taker in my family. Like, even if they're in another state, I'm like, call me and put me on speaker. Like, I have questions, I need answers. Yeah. And it does. I think it helps the other person just kind of relax a little bit, knowing someone's in their corner, and lets them formulate their questions, take a deep breath, because I feel like it could be like a high stress situation often too, just like even talking to the doctor about what's been going on.
Exactly. And the one other thing I will add is bringing a list. Because you get in there and you've had someone taking your blood pressure, you may have gotten there late, everybody's kind of yelling at you or talking at you, and it's good to have a piece of paper. And sometimes I have patients who bring 2 copies, one for them, one for me, and then we just go down the list, right? Because you've been thinking about this for weeks, months, whatever, and then you get 10, 15, 20 minutes with the doctor, and all of that stuff goes out of your head. So bringing it to the table right up. And if you can't, sometimes we'll say, okay, we can't get through this entire list right now. Let's do a phone call in 2 weeks, or let's have you come back, or let's get this testing done, and then we'll process these other things.
Got you. So now I have a question. I am the policy director here for NAN LA, and we just noticed that Governor Newsom just passed the Momnibus Act, which is going to do more research about childbirth, maternal health, and families of color. Are there certain policies that have just been passed in the area of internal medicine, or that are maybe on the horizon that could also help internal medicine that we might need to know about and fight for? And because, people the action, this is what we do here. So, do you know of any?
it's hard because in California, we sometimes, even when things at the national level are kind of going in the wrong direction, sometimes California legislature will pick up the slack.
Right.
But I think, recently the failure to approve at the congressional level the extension of COVID benefits, meaning, free COVID testing, and free vaccination. That's a huge thing. And then all of the healthcare changes that we've seen with COVID, where the virtual visits are now kind of being accepted as much more useful. For some patients, that's incredibly helpful. For people who live in more rural areas or people who live who just have transportation problems, but it shouldn't replace in-person visits when they're needed.
Gotcha.
We've got to have some standards for virtual visits, and so I think that's a critical area. I encourage them, but I also say we need to think about how to make them most effective. I think the other thing to think about is all of those social benefits, like the that give parents extra funding for their kids. Those types of benefits can have a profound impact on the well-being of those kids over time. So all of these sort of tax reimbursements for parents, what we've seen is those kids do better over 5 or 10 years after their parents have received those benefits.
Really?
They do better in school. They have better health outcomes. So it's recognizing that these early life exposures can have a huge impact on kids over time.
So, yeah, I mean, I guess that makes sense, right? With the first 5, and they get the fresh foods and whatnot. Yeah, that makes sense.
But the other thing that we see is a lot of times Black families are less likely to take advantage of those types of resources. So I think one thing that's important is both having the resource available and making sure that people don't feel either stigmatized taking use of those resources or aren't deterred when they go to get the resources.
Right. Yeah, that's one thing that our healthcare expert Tia has been really working with is just just letting people know that the resources are out there, right? Sometimes we don't even know those resources are out there.
Or when you don't feel welcome.
Right.
So that's the other thing.
That's another thing as well. Yeah, definitely. So we have a question from Carmen in LA. What foods can control blood pressure and diabetes? And if food choices can take the place of medication.
So I never say there's any food that can take the place of medication. And I also don't say there's any medication that can take the place of healthy food. So I view them as two different things that are complementary. But one of the things that we find is that, thinking about your plate, half your plate should be like leafy green vegetables, brightly colored vegetables without a lot of sugar or butter on them, right?
Okay.
And then
butter makes broccoli so much better.
I've got a little bit of butter.
Okay.
All right. And then the other thing is that you can have, whole grains, so think about, quinoa, other types of grains, because rice is just carbs, right?
Even brown rice?
Yeah, brown rice isn't that good for you either.
Really? Okay, good to know.
But small amounts, if you're going to have it, have a small portion to go. And then protein, sort of the amount of protein you should have should be like less than the palm of your hand, right? So that's the size. And you try to go for lean protein. And then, as I mentioned before with the vegetables, fruits are great for dessert, but peach cobbler is not a fruit. And so understanding that you want fruits that are that are like straight from the tree,
right,
in their natural form, if possible.
Right.
So that healthy eating, that approach will carry you really far. And then the snacking is another thing. Okay, so snacking on, we all, some of us snack a lot more than others. I snack a lot, but trying to snack on almonds and that are not salted, raw almonds, or if they're even if they are kind of processed in some way, not a lot of salt. So thinking about ways to really keep foods as natural as possible. Some foods actually, it's better to cook them, but it's really important to really try to avoid a lot of processed food.
Okay, and we have another question from, they just gave their place and not their name. I think they're in Compton. When is fruit too much fruits for your sugar?
Yeah, no, that's a very good question. And I have a relative who, when she was diagnosed with diabetes, her doctor told her, okay, you can only eat green apples, no other fruits. And it made her life miserable. So I think everything in moderation, right? So, certain fruits, like very ripe mangoes and ripe strawberries, things like that, they're great. But again, moderation.
And bananas have a lot of sugar, right? I just learned that myself.
Exactly. So with bananas, I tell people, have half a banana, right? So as opposed to the whole thing, because bananas have a lot of sugar in them. And a lot of fruits do have a lot of sugar, but if the choice is a fruit or a Twinkie, I would go with the fruit. Right? And I think the other thing is people think smoothies are fruits and vegetables. You are much better off getting your fruits and vegetables directly and not through smoothies, because
really, talk a little bit about that.
Yeah, well, you know what? You can ingest many, many, many more calories in a smoothie than you will if you were to just eat the fruit by itself. And so, because we think if you're going to have like a grande version of a smoothie, that's probably like 3, 4, 5 times as much fruit as you could eat if you were to chew it.
Gotcha.
So it adds the calories, and a lot of times those smoothies don't have the fiber, right? So you really want. I deter people from replacing fruits and vegetables with smoothies.
Got you. Because I am a smoothie queen, but I put spinach in my smoothie. Does that?
You're better off just eating the spinach. I'm sorry.
You used to be my favorite. Now I'm not so sure.
And you know what? In moderation, right? So I think the problem is it's like that palm of your hand thing. If you have a small glass of smoothie, that's fine, right? But most people don't. It's kind of a few sips. And if you're going to have a smoothie, think of it as dessert. Okay. It's not breakfast. It's not a meal. It's dessert.
Okay. Good to know. Well, now that you have hurt my feelings, I think I'll throw back to Lori. No, but thank you so much. I think we have all of our questions answered so far. But
prescriptions.
Oh yes. Triple checking. Can you speak to the importance of triple checking your prescriptions? Doctors and pharmacists make mistakes, and often Black women are so busy multitasking that we don't have time to pause and ensure what we're supposed to take is what we have.
Yeah, that's a great question.
And that came from Tia, our health expert, by the way.
It's happened to all of us, and both as a clinician and as a patient myself, where sometimes there's a miscommunication about what the person's actually taking. It's written one way, one place, another way, another place, or you change the prescription. So if it doesn't look right, stop. It's better to stop, call, and talk to the pharmacist. The pharmacist can be your best friend. So with the pharmacist, even if you can leave the pharmacy with the prescription, but the pharmacist can check with the providers and say, hey, this looks wrong, right? And just know that I'm not sure this is the right prescription, but you have to double and triple check. I completely agree. Because things are very fluid.
Yeah, no, that makes sense. Okay, well, thank you so much. This has been very informative. Again, you hurt my feelings, but it's okay. It's all for the greater good. I'll throw it back to Lori now.
All right. Thank you, Rashida. Thank you for that. And Dr. Brown, you gave us some excellent information. Even though you hurt Rashida's feelings, it's okay. She'll eat her spinach and we're going to be all right.
All right.
We thank you for your time here this morning. We thank you for the great information. And thanks again.
No, thank you. This has been fun, and I wish you all the best. This is such an important organization once again, and keep fighting the good fight.
If it's okay with you, may we put your presentation online for other folks to be able to get great information?
That's fine.
All right. We thank you again, Dr. Brown, for joining us this morning.
Right.
And we will send you the video of the rebroadcast as well. Thank you, audience from Compton to Florida. We thank you for joining in this morning and for your questions. And with that, we wish everyone a good day. Again, if you want to join National Action Network, go to $NANLAX, $25 a year. Come join us. Come help in the struggle. Come help in the fight. Thank you so much, everybody. Have a great day. Bye-bye.